So my name is Elani and I'm working with UNAIDS based out of their headquarters in Geneva. I'm actually working purely on UNAIDS' global programming with the Deputy Executive Director of Programs. So we oversee the entire range of all of our HIV prevention and treatment work as well as our human rights work. Well, as far as UNAIDS' work goes, PrEP is actually a very crucial part of combination prevention. It's one of the 5 pillars that we're advocating for within prevention. And why it matters to me specifically is that I'm a very firm believer in the right to choice and the right to health. It is our body and our choice. And PrEP is a very valuable tool within combination prevention. People should know about it and they should have access to it if they want it. So UNAIDS is supportive of policy that will allow people to have access to PrEP and the right to health more broadly. So we're working with communities to find out what they need, what the barriers are to PrEP access, and then talking to policymakers to see how we can help change things for the better. And as far as my own work goes, I've been looking at the situation within Europe and been participating very actively in dialogues with key populations to look at what the needs are and how it intersects with various legal challenges such as criminalization. So I think PrEP is a really interesting opportunity to start having a conversation again about comprehensive access to sexual health and rights, because it is an issue of well-being, and that includes sexual well-being. And that's something that becomes really absent from public health discourses these days. It's about emancipation, and the reason it's very fascinating, especially in the European context at least, with the data that we have available, is we see how non-discriminatory health services, access to testing, rapid linkage to care, how all of those things kind of come together with PrEP to actually start turning the tide on new HIV infections.